Hello, and welcome to the monthly health talks brought to you by the Center for Asian Health Research and Education in the Stanford Health Library. My name is Bryant Lin. I'm co-director for the Center for Asian Health Research and Education. I'm very pleased to introduce Dr. Neeta Gautam, who will be talking about an introduction to Ayurveda, the science of life. Ayurveda is the traditional medical practice of India and one of the world's oldest continuously practiced healing traditions. In this talk, Dr. Neeta Gautam, a family physician and Ayurvedic wellness counselor, will introduce you to the history, background, and fundamentals of Ayurveda and how these ancient practices can be applied in today's world. Dr. Neeta Gautam received her medical degree from Texas A&M University Health Sciences Center in College Station, Texas. She completed her residency in family medicine at the Scott White Hospital and Clinic in Temple, Texas, and also trained as an Ayurvedic wellness counselor at the Kerala Ayurveda Academy, USA. She is a clinical assistant professor in the Division of Primary Care and Preventive Medicine in the Stanford University School of Medicine in Stanford, California. She is also director of Integrative Medicine at the Stanford Center for Asian Health Research and Education. Her interests include prevention, integrative medicine, establishing partnerships with patients to optimize their health. I'm very pleased to welcome Dr. Neeta Gautam.
Dr. Lin, thank you so much for that very kind introduction. And with that, we will get started. So tonight we're going to be talking about an introduction to Ayurveda. And Ayurveda is often compared to an ocean. And tonight we're going to dip our toes into the ocean and start learning a little bit more about it. Before we begin, I want to take a moment to thank all of you who have taken time from your really busy schedules to join us here and to express my appreciation for your interest. Whatever you were doing 5 or 10 minutes ago, let's take a moment to take a breath in and out. Do it one more time. Nice breath in and out to help everyone feel a little more settled and get started with our presentation. In a few minutes, I'm going to be asking you a series of questions to think about. If you would like to get a sheet of paper or however you would like to make note of your responses, feel free to do so. There's no score. Everybody passes. It's just for your own informational purposes. A quick note, this presentation is for informational purposes. It's not meant to replace your medical care, and I'm not asking you to stop or change any of your medications without consulting with your physician or provider first. So just with that caveat, let's go ahead and get started. Our objectives are to provide some background in the science of Ayurveda, introduce some common terms and concepts, and share some lifestyle recommendations based on your constitution type. And we're going to get into a lot more detail about that in just a moment. A little bit of background to begin with. Ayurveda, the term Ayurveda comes from the Sanskrit, and it's 2 words, Ayur, which means life, and Veda, which means wisdom, knowledge, or science. Thus, Ayurveda is the knowledge or science of life. It's among the world's oldest continuously practiced prevention and healing systems. It's been in practice for an estimated 5,000 years. It started as an oral tradition passed down from teacher to student across multiple generations. The earliest recorded texts indicate that they are merely writing down what was an established oral tradition. Its main focus is the prevention of disease and promotion of positive health. And health is defined as a state of balance of mind, body, spirit, and environment. And promotion of the body's capacity for self-balancing and self-repair. The healing is within you. The knowledge is within you. So the goal of Ayurveda or an Ayurvedic doctor is to find that and unlock it and allow that to happen. This quotation from the Sanskrit encompasses what is considered health from an Ayurvedic perspective. And it's one whose constitution is balanced, one whose digestion is balanced, one whose body tissues elimination is balanced, and whose senses, mind, and self are filled with bliss. Such a one is called a healthy person. I really love this quote because it talks about health not being strictly about the body. It's the body, the mind, it's how everything's functioning. And also it's about more than the absence of disease, which is sometimes a pattern we fall into when we think about health. And the World Health Organization, the WHO, echoes this in their definition of health. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And that this is a fundamental right of all of us, without distinction of race, religion, beliefs, economic, or social conditions. And so we're seeing this idea of this all-encompassing, a holistic approach to what health means beyond not being acutely ill. Moving forward, of the fundamentals of Ayurveda, there are 5 elements in Ayurveda, and you're going to see these come up over and over again as we continue discussing. And again, this is not meant to be any sort of quiz. You're going to just hear these over and over, and it's just a matter of getting familiarized with them. So the 5 elements make up all of the universe, and that is everything that you can imagine and think of is some combination of these 5 elements, including us. And those 5 elements are space, air, fire, water, and earth. And so as we think about those different elements and the qualities or what we associate with those elements, you'll see that come into play as we talk about our constitution and the impact of these elements on our beings. So when we think of space, like outer space, it's clear, it's very subtle, right? It's not visible. It expands. It's always moving out in all directions. Air, like our atmosphere, it's light, it's dry, it's mobile, it's variable. Today has been a windy day, but the wind is never constant, right? It comes and goes. Fire, we think of hot, sharpness, water, flowing, the wetness, the dullness of it, and the earth, right? Hard, dense, static, solid, in comparison to space, so light and expanding. So we're going to see these elements come into play as we move forward. Those 5 elements come together in different combinations to form the 3 doshas, or constitution types. The first one is Vata, which is a combination of space and air. Pitta is the second one, and it's a combination of fire, mostly with a little bit of water. And Kapha, a combination of water and earth. And we're going to talk about these each in more detail as we go forward. It's important to know that all of us are some combination of all 3 doshas. The combination is determined at conception. It's influenced by the makeup of the parents, but not strictly genetic, but as well as environmental factors. So there's that interplay there between what's going on in the environment, where you live, the background of your parents, that all come into play in determining your constitution. The term for the unique constitution of an individual is prakriti, and we'll talk about that a bit more as well. By definition, doshas can go out of balance, and they vary, they fluctuate day to day, within a day, different seasons of the year, different seasons of our life. That's meant to happen. When it goes beyond a certain stretch point, that's when illness can occur. Usually when a certain dosha has expanded beyond the typical or the normal range for that individual. This is really important, and I want to emphasize there is not one ideal dosha or combination of doshas. We are all unique. We all have our own balance, and the goal is not for all of them to be equal. The goal is not for all of us to be the same. We're our own individual. The goal is to understand what our individual makeup is, learn what that means about being in balance, and what can disrupt the balance for us as our own person. So what is my dosha, or what is your dosha? This is the part where we're going to ask a few questions. I want you to take a look at each question. We'll go through them one by one. And just take a moment to jot down which number, 1, 2, or 3, describes you most of the time. There may be times where you feel like you're one answer or the other answer, but most of the time, in most situations, pick the one that resonates with you. And then we'll go over what those mean after we've gone through the questions. If everyone's ready, we'll move forward. Okay, give everyone just a second, make sure you're ready to go. And with that, we'll get started. So question number 1, physique and weight. 1, I am a slim, slender person. I hardly gain weight, and if I do, I can lose the weight easily. Option 2, medium build, good muscles, don't gain or lose weight very easily. Number 3, I'm well built. I tend to gain weight easily and have a hard time losing weight. So take a moment, which one of those resonates with you, and make note of what your answer is. Question 2, skin and hair. My skin is, number 1, my skin is dry, thin, and prone to itching. My hair is thin, dry, and brittle. Number 2, my skin has red undertones, moles, freckles. My hair also has a reddish tone, and I may have a receding hairline or premature graying. Can also be a feature of number 2. Number 3, my skin is smooth and soft, sometimes looks pale. My hair is thick, full, lustrous, maybe slightly oily. Take a moment to jot down 1, 2, or 3. Then we'll move on to the next one. Number 3, eyes. First answer, my eyes are small and can feel dry or unsteady, always moving around, darting. Number 2, my eyes are medium in shape, sharp and penetrating. Number 3, my eyes are big and round in shape. Number 4, hands and fingers. My hands are small, dry, rough, and my fingers are long, thin, and narrow. Number 2, my hands are generally moist, pink, and my fingers are medium and pointed. And number 3, my hands are generally firm, thick, excuse my typo, and my fingers are large and stocky. Number 5, complexion. Number 1, my skin is dull or dark in tone. Number 2, my skin is red, ruddy, and glowing. Number 3, my skin tends to be white or more pale. Question 6, activities and actions. Number 1, I'm a very active person. I like to walk fast and talk fast, always on the move. Number 2, I like to think before I do anything. My actions are very thoughtful and precise. Number 3, I am steady and graceful. I take my time to do things. Question 7, sleep. 1, I do not sleep soundly at night. I toss and turn, and I tend to wake up early in the morning. Number 2, I'm a light sleeper. If something wakes me up, I am able to go back to sleep. Number 3, I am a heavy or a deep sleeper. Question 8, appetite. Number 1, varies. Sometimes I'm hungry, sometimes not. I can feel anxious if I don't eat. Number 2, I'm always hungry. If I don't eat, I get irritable and angry. Number 3, I don't feel very hungry and I can easily skip a meal. Number 9, bowel movements. Option 1, I tend to get constipated and may not have a bowel movement every day. But number 2, I have regular bowel movements that sometimes are loose. And number 3, I am very regular with my bowel movements. You can set a clock to me. Question 10, speech. Option 1, I'm a very talkative person and a storyteller. Number 2, I speak very clearly and to the point. Number 3, I take time to start speaking. I'm not always clear about what I want to say. I'm a better listener than talker. Question 11, emotions. 1, I'm a born worrier, often feel anxious, nervous, restless. Number 2, I can get irritable or angry if things don't go my way. I easily get impatient. Number 3, I'm happy, caring, and loving. I'm usually very calm, and it takes a lot to make me mad. Question 12. We're doing great. We're almost done with the questions. Just a few more. Memory. I remember quickly, but I forget quickly. Option 2. I remember what I want to remember, and I never forget. Option 3. I'm slower to remember, but once I do, I never forget, and I'm able to remember minor details. Question 13, resistance to disease. Option 1, I tend to fall sick often. Option 2, I have medium resistance. Option 3, I have a strong immune system and I hardly ever get sick. Question 14, health problems. Option 1, I tend to have issues with constipation, anxiety, depression, pain, or fatigue. Option 2, I tend to have skin infections, fevers, heartburns, acid reflux. Option 3, I tend to get allergies, congestion, weight gain, or this feeling of slow or sluggish digestion. Final question, personality. Which slogan or saying best describes you? Option 1, can I change my mind? Option 2, my way or the highway. Option 3, don't worry, be happy. So if you've been jotting down, you may see that there's a trend in terms of which answers resonated with you. If you picked mostly ones, that means in your constitution, there's predominance of Vata. In mostly 2s, Pitta, and mostly 3, Kapha. I want to point out that very few people are strictly 1 dosha. Most of us will have 2 that seem like they were slightly ahead of the 3rd one. A few of us will say that all 3 were equally the same, and that's called tridoshic. Not very common, just like being strictly monodoshic is not very common either. So there's usually 1 or 2 of them that will be most common. So with that, now that you have some sense of maybe where you fall, and this is a very basic evaluation, there would be a lot more taken into account if we were sitting down one-on-one and having a more detailed discussion about your health and your health status. But just to give you a general sense of where you fall as we go through this conversation a little further. We're going to talk now at this point a little bit more detail about each one of the doshas. And as I go through this, I'm going to talk about things that can cause imbalance and things that you can do to help rebalance the dosha. Ayurveda is very practical. So it's not meant to be prescriptive if you follow all these rules or don't bother at all. As you go through this with me, see if there are 1 or 2 things that might resonate with you that you think make sense or would be reasonable for you to try to apply to your life. We're also going to talk about, in addition to dosha-specific suggestions, we're also going to talk about general guidelines that are helpful for all of us to consider in terms of optimizing our lifestyle. So with that, we will start with Vata. As a reminder, Vata is a combination of space and air. It controls movement, right? You think of space, air, the wind. It's the only dosha that moves. That makes it unique. And so it's sometimes called the king dosha because that. It controls the movement throughout the body. So anything that moves within the body, circulating, breathing, the movement of your digestive tract, the elimination of wastes. Speech, the movement of the vocal cords, allowing me to talk to you this evening, is governed by Vata. When we think of space and air, the qualities that we think of are dry, light, cold, rough, quick, and movement. Also, variability, just like the wind never blows at a constant speed all the time. Sometimes it's windier than others, or sometimes there's no wind at all. That variability is also a feature of Vata. So characteristics in the personality of someone who has a Vata predominance. They're very alert, they're very enthusiastic and creative. These are the people in a group who are the ones who come up with all the great ideas in the brainstorming session and the grand plans of the things that we can do or do better or do differently. They're quick to pick up new things. They're also quick to forget because they are constantly on the move, constantly moving on to the next new thing and the next new thing and the next new thing. They complete their tasks quickly. They tend to be, in general, of lighter frame and have more prominent joints. So if you look at the hand, that their joints of the hand seem a bit prominent, that can be a characteristic of someone with a Vata predominance. What can cause Vata to go out of balance? So we think, anything that would increase the qualities of Vata, coldness, lightness, that movement. So intake of foods that have those same characteristics, very dry, very light, very cold. Exposure to cold or wind, again, increasing exposure to something similar to those characteristics increases that within your system. Too much loud noise and screen time. Our attention span is becomes so short because we're so quick to moving on to the next, to the next, to the next, whether that's at work or we're browsing on our computers, that can sometimes lead to an increase in Vata. Irregular routines, variability in sleep time, wake time, work time, and we're going to talk more about that later, about the importance of routine. Fasting or skipping meals can increase Vata. Excessive exercise and excessive travel. Again, all of that related to excessive movement can increase Vata in the system. So what happens? How does that look when someone's Vata is out of balance? They may report dryness in the skin or the joints, pain in the joints, constipation, hard bowel movements, irregular bowel movements, fatigue, feeling anxious, trouble falling asleep because everything's so on the move, everything's going, that it's hard for them to turn off, unwind, and be able to rest. Loss of weight. Vata folks in general, harder for them to gain weight, easy for them to lose weight if they get out of balance. Very easily distracted, harder for them to keep on task and complete a task. So what can they do to help balance that excess of Vata if they're feeling those symptoms? You want to look for things with opposite characteristics. So we're looking for things that are warm, that have more liquid, heavier foods, things that will ground that Vata individual. Sweet foods, warm beverage, light exercise. So someone who's Vata should try to avoid overly strenuous physical activity because that tends to increase the Vata element within the system. Being very consistent about their routine. Of all of the doshas, the Vatas are the ones who most need to be really consistent with their routine about bedtime and wake up time, when they start work, when they stop work, when they eat their meals. That sense of routine is really important to balance the Vata. And taking on one task at a time. They're so quick with new ideas and so ready to move on to the next thing. It's really helpful for Vatas to try to be mindful to slow down, finish one thing before they try to take on the next challenge. In balance, they want to avoid things that are dry and cold, strenuous exercise, excessive travel, trying to do multiple tasks. So the multitasking is not great for those who are out of balance with Vata. We'll move on next to Pitta. And as a reminder, Pitta is predominantly fire with some water to help balance out the fire element. So when we think of fire, that's digestion, transformation, metabolism. So the sense of hunger, the sense of thirst, the breakdown of food products so that it can be spread throughout the body. That is Pitta's predominant actions. So when we think of the fire and water, we're thinking hot, sharp, sour. So think of acid as a liquid form of fire flowing in liquid. So the characteristics of Pittas, those with Pitta predominance: strong concentration. They are on task and they will get it done. They are the ones in the group. The Vata person's come up with all these great ideas. The Pitta person is your logistics person, who's going to be able to go, here are the steps we need to follow, here are the rules of how we're going to get it done, and see the project through to completion. Strong digestion. They have that increased fire of digestion. They do well with most foods. Sharp intellect. Sometimes they're considered natural leaders. A lot of heads of companies, presidents, doctors tend to have a Pitta predominance. Good energy level, lustrous complexion. They might have reddish undertones to their skin. Good communication. They're to the point. No beating around the bush in terms of what they want to say. They tend to be of medium size, medium frame, medium appearance of the hands and the joints. What can cause a Pitta to go out of balance? So anything that would increase the heat or the fire in the system. A hot climate. Foods that have those fire type qualities, sour, salty, pungent foods, tobacco use, alcohol use, caffeine, being very competitive, viewing everything as a competition or trying to always outdo someone else can raise the Pitta. And excessive mental stimulation. They're always trying to go, 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 go. That can lead to too much Pitta in the system. What does that look like if someone's out of balance with their Pitta? They can be irritable or angry, short-tempered. That being to the point can sometimes be a little too direct, a little too harsh when that Pitta is out of balance. They're predisposed to heartburn, skin rashes, so red type rashes or reddish outbreaks. It can lead to loose bowel movements. That fire is just burning through everything. It's sort of like disintegrating it. Fevers, inflammation, sweating, burning of the eyes, any redness of the eyes. Those are characteristics of a Pitta who's out of balance. So again, like we talked about with Vata, when we think about what would be helpful for Pitta, we think about things that are the opposite qualities. So instead of looking for more spicy, sour, acidic foods, which sometimes is what the Pitta craves, they need to eat things that are cooler. They tend to do better with cooling foods than others. Leafy green vegetables, sweet things, astringent foods like pomegranate tend to be a good idea in terms of balancing a Pitta constitution. Spices that tend not to be heating, like coriander, turmeric, fennel, can be good for a Pitta. They want to try to stay away from like the red pepper or the black pepper. Moderate exercise, but again, not the strenuous exercise. Time outdoors, being in nature is really helpful to balance Pitta, but not during the middle part of the day when the sun's highest, right? The highest temperature of the day, again, could increase the Pitta constitution. And letting go of the need to be in charge. Pittas are used to jumping in and taking over, and they need to be mindful of stepping back and allowing others to contribute and be part of the process of getting things done. And finally, we're going to talk about Kapha. As a reminder, Kapha is a combination of water and earth. And so Kapha provides your structure. So the structure of the bones, the muscles, the organs, that's Kapha. Also, the lubrication of the joints, that liquid in the joints, is related to the Kapha dosha. Mucus production, tissue formation. So we think about solid, stable, structural, doesn't move rapidly, can be a little oily or dull even. So the characteristics of Kapha, they are the strongest in terms of physical strength, body structure, immunity, their joints and bones. Because of that, they tolerate more strenuous exercise than either Pitta or Vata predominant types. They're very calm, they're very kind, they're very generous. So in that group, if you imagine all three types are present, and the Vata person has come up with the great ideas, and the Pitta person has come up with the rules to get it done, the Kapha predominant person is the one who's going to make sure everyone gets along and is happy and is looked after throughout the process. They're a little slower to pick up information than the other two groups, but once they retain something, they have it. You don't have to worry about them forgetting it or losing track of it. Once they know it, they know it. They're very slow to anger, very calm, kind people. They tend to have large eyes, very thick hair, and again, that solid frame, more so than the other types. Causes of imbalance. So anything that increases that cold or heaviness in the system is going to cause that imbalance. So sweet, sour, salty foods, junk food, large volumes, taking in large volumes of food, cold foods, heavy foods, ice cream, cheesecake are classic examples. Lack of physical activity, oversleeping, and daytime napping. It generally is not recommended. There's always exceptions, but those things can cause an increase in kapha. So how do we balance it? The kapha person has the benefit of being able to eat most spices, except for salt. Salt will increase kapha. Vegetables, going with foods that are lighter in consistency, and the astringent foods like we talked about with the pitta types. They want to limit things that are very heavy: red meat, dairy, ice cream, sugar, salty foods can increase kapha. They should exercise regularly. They're the ones who do best with the moderate or more strenuous exercise. Their bones and joints have better tolerance for it. But sometimes if they're a little out of balance, they may not have that motivation to get up and move. And so that's where their friend who's Vata or Pitta can come along and help get them up and moving. And once they're up and moving, they do great. Moderation in portions is important, as well as not eating the next meal until the previous one is fully digested. In general, kapha digestion tends to be a little slower, and you want to make sure that the body has processed one meal before bringing in the next. And just to say, when we talk about limiting things, it's not a strict do or don't list. So it's not that the Vata person can't ever have anything that's dry or light, or the Pitta person can never eat anything spicy, or the Kapha person can never eat anything sweet or red meat, but to be aware that there's that predisposition, and so to be mindful of how much of it one takes in. So now we're going to talk about some recommendations that are helpful for all of us, regardless of our dosha type. This proverb, I think, is great and really speaks to the role of diet and our nutrition in terms of our health. Without proper diet, medicines are of no use. With proper diet, medicines are of no need. Now, I'm not advocating or asking you to stop any of your medications that you're currently taking. It just highlights an observation that I've had in my years of clinical practice, that there are people that I see, and it seems no matter how much medication we give, we cannot seem to manage the condition. It's very hard to out-medicate a poor diet. Conversely, I've also had the fortune to see many folks who, when presented with a diagnosis of an illness, really do make a change in terms of how they eat and their lifestyle, and are able to do just great and not need medication to manage that condition. So it's really reinforcing that the self-healing is within you. It's not about guilt or judgment, but that you have that potential. And so to the extent that you're able to tap into that, you are able to optimize your health and your well-being. So for all of us, these are some ideas that we can consider. When eating, sit down during the meal. I know for a lot of folks, you have young children or work, it's hard to find that time to sit, but to the extent possible, making sure you're sitting when you eat. Try to eat in a quiet atmosphere. Try not to eat while working, watching TV, on your devices, during your meal. Be aware of your meal. We've all probably had that experience. You're watching TV or doing something else and you're snacking, and then you look down and realize you've completely finished whatever it was you were snacking on, and you missed out on the experience of tasting and enjoying that food. So really being mindful and taking that time to appreciate what you've prepared or what you have, eating it in a mindful manner. Try to avoid packaged, processed, and microwaved foods. And try to favor, to the extent possible, what I call soul food. So seasonal, organic, unprocessed, and local. Again, to the extent possible. Ayurveda is very practical, and this is not about all organic or nothing, all local or nothing. It's about what you're able to do in the context of your life. And this brings up the concept of prana, or life force. So the belief in Ayurveda is that these soul foods tend to have more life force in them, so more nutritious, more nutritional value. Packaged, processed, and microwave foods, junk foods, don't have that same prana in them. And so we can imagine, some of these lovely vegetables here on this picture compared to fast food, and not, everybody enjoys their fast food, but just saying you sense that, right? That's something that you are aware of at some level, that there is a difference in terms of what you feel and how you do after one meal versus another, depending on how it's prepared and what's included in it. Try to avoid or limit cold foods or drinks. So that can affect the digestive fire. We're going to talk about that more in just a moment, but just briefly, Agni is the Sanskrit term for fire. And so just like that's one of the elements, it's the fire of our digestion. So imagine that you have a campfire and you pour something cold on top of it. You're putting out the fire. You're impacting the body's ability to efficiently process what it is you're eating. Hot water is thought to be good for digestion, be cleansing, and aid in the removal of wastes. The caveat is if someone has a strong Pitta imbalance or a lot of heartburn or acid reflux, to use warm water and not hot water, because it could aggravate that. For many people, unless they have a very strong digestion, raw food, so raw salad, raw vegetables, can be hard to digest and process. So the recommendation is to go with cooked vegetables. That cooking improves the absorption of nutrients, and including some spices in it also promotes good digestion. So a classic example is tomato. So raw tomato versus cooked tomato, you get more of the lycopene out of the cooked tomato than you do the raw tomato. And so that's one example of getting more nutritional bang for your buck by cooking your vegetables compared to eating them raw. Sometimes the question comes up, well, what about fruit? Fruit, this doesn't apply to fruit. When the fruit ripens, that's considered its own type of cooking process. So eating a ripe fruit is considered okay. You don't have to cook all your fruits in addition. For all of us, some other good ideas: eat until you're 2/3 to 3/4 full, until you feel satisfied but not stuffed. The idea is you want to allow some space in the stomach for the digestion, that movement of the food within the stomach as it breaks down to do its work. Avoiding taking one meal until the previous one has been fully digested. So allowing time for the body to finish breaking down that meal and process it. If it's in the middle of that process and then you bring in more food into the system, the body then has to shift to break down the new food, and the previous meal may not ultimately be properly digested, metabolized, and disseminated throughout the body. Talking a little bit more about routine, and for all of us, this is a good idea. Consistent routine matters. So bedtime, going to bed by 10 p.m., waking up by 6 a.m. We're going to talk about clocks and timing in just a moment, but just to make those points right now. Exercise ideally in the morning, and we'll talk about why before 10 a.m. in a moment. And the exercise intensity varies by dosha. So the Vata predominant folks, lighter exercise, and then Pitta, more moderate, and Kapha, the more strenuous exercise. Routine is really important for Vata, but it's helpful for all. Something I commonly come across in my clinical practice is that a lot of folks have a certain bedtime and wake up time during the week, but on the weekends or when they're not working, those bedtimes and wake up times can vary by as much as a few hours either way. And it's almost like the equivalent of getting into a plane every week and flying somewhere else. And it's like you're creating your own jet lag. And then it's understandable that come Monday morning, when you have to get back up earlier than you were on the weekend, that you feel more sluggish and it's harder to get back into the swing of things. So being consistent weekdays, weekends, to the extent possible, can help mitigate that. Meal times, also consistency matters. Trying to have your breakfast by 8 o'clock, lunch between 12 and 2, and lunch should be the main meal of the day. And the reason for that is at midday, just as the sun is the highest in the sky, that's when our digestion or the sun or the fire in our bodies is the strongest. So it's most able to handle food at that time of day. So that's what you want to be your heaviest meal. And there have been studies in the field of chronobiology that look at this. In one study, they had two groups of people, same food. One was fed, excuse me, around 12 o'clock. One was fed after 2 o'clock. The group that was fed after 2 o'clock had an increase in weight gain. The 12 o'clock folks did not, and they were taking in the same amount of food. And eating dinner before 8 p.m. And that ties into the bedtime. You want to make sure there's a couple of hours between when you finish dinner and when you go to bed, allowing the body to finish digesting before you lie down for the night. Water intake. I know there's the magic 8 glasses a day. And when we look back into the nutritional science, there's not really great evidence that all of us need to be drinking 8 glasses of water per day. According to Ayurveda, how much you need to drink depends on your dosha. Vata, remember, that's space and air, so really light and dry and cold. They need more moisture, more water. So they tend to need to move more. Pitta's in the middle between 5 or 6, and Kapha, because they already have that increase of water in their constitution, tend to need less. Given that, though, you need to see where you are in terms of your health conditions, and this is not a hard and fast rule, but just a general guideline is something to consider. I just wanted to mention this one tea. It's called CCF for the spices that are included in it. And this can be helpful for digestion, reducing gas and bloating, help regulate bowel movements. So in a pot, you boil 4 to 5 cups of water and add half a teaspoon each of cumin, coriander, and fennel, so the CCF. Let that boil. You can strain out the seeds or not, that's up to you, and keeping it in a thermos, sipping it throughout the day. And that can be helpful for some of those conditions. Sometimes I recommend it to patients when appropriate, if they're having a lot of trouble with their digestion. So just like the doshas apply to us as individuals, they also apply to the time of day. And this is where those recommendations about routine come in as well. So the clock is broken into 4-hour segments. The 2 to 6 a.m. and p.m. time frame is Vata predominant. 6 to 10 a.m. and p.m. is Kapha predominant, and 10 to 2, the middle part of the day, is Pitta predominant. So when we think about that, so getting up by 6 a.m., so that's before the Kapha time of day, when there might be a sense of heaviness or sluggishness that comes in. And many of us have had that experience where it's the weekend or we have a day off and we're going to sleep in thinking we're going to get more rest. But then when we wake up, maybe feeling a little more tired or not as refreshed as we thought we would be because we've slept into that Kapha time of day. That Pitta time of day from 10 to 2, again, that midday when the fire is the strongest, both within us and the sun of the sky, that's why you want that main meal to happen during that time, because that's when Pitta is strongest. And then when we talk about Vata time, as we move from 2 to 6, the Vata increases in our system slightly, and that's what leads us to tend to wake up, and the sleep gets lighter as we get closer to that time of morning. As we move into the evening hours, the 6 to 10 p.m., we're eating our evening meal, we're starting to wind down and go to bed. And we want to be in bed by 10 p.m. before that nighttime pitta kicks in. Sometimes we take that as our second wind, right? We feel that fire come back up, that energy come back up, and oh, we're so productive and we get a lot done. But from the body's perspective, what the body wants to do during that time when you're resting is finish metabolizing all the inputs of the day. That's your food, that's your thoughts, that's your emotions, that's your time to process it and, get ready for the next day. If you're up during that time, working during that time, eating late at night during that time, you're interfering with the body's ability to finish processing the day. It's delayed and you don't make up for it later on. That time doesn't then shift to when you fall asleep. That's fixed. And so you're missing on that opportunity to finish the processing of the day in order to get ready for the next day. Doshas also apply to the seasons of the year. And this, as we think about it, and the characteristics of it makes sense. So summertime, when it's hottest, is a pitta predominant season. So pitta related conditions, heat, rashes, inflammation, redness can be more common this time of year. Fall and early winter, Vata. So it's lighter and colder and rougher. You may feel more dry skin or dry hair, dryness in the joints, a little more achiness with that dryness. And then late winter into early spring is the Kapha season. So we think more congestions, colds, coughs, right? That phlegm tends to be more common that time of year. And doshas also apply to the stages of life. So in childhood, that's a Kapha predominant time. So we think as children grow and they build structure and they're getting bigger and stronger, that's the formation of their body, that's Kapha. As we transition into adulthood, that's a Pitta predominant time. This is a time when many people are pursuing different careers, they're starting their families, they're providers, and they're taking care of themselves, their communities, their families. So that Pitta fire tends to be predominant. And then as we transition into older age and we're not in that active role, Vata becomes more predominant. And you can see that in the conditions that tend to affect people in those different stages. Kapha, you think of kids. I see children in my practice, lots of coughs and colds and congestion and runny noses and things like that. Pitta, that fire, that burning, maybe they're heartburn or rashes or things like that. And Vata, the dryness of the joints, maybe feeling a little more achy or fatigued. More easily, sleep is more disruptive in older age, and it could be because in Ayurveda, it's thought perhaps related to that increase of Vata generally. We've touched a little bit on this. I'm just going to reiterate, Agni is the term for fire, and that applies to the sun as well as the fire within us in terms of our digestion, not only in the stomach, but in the tissues. It's responsible for food breakdown and the use of those products within the tissues. The doshas can also affect the Agni and the quality of the Agni. So Vata imbalance. We're sitting in front of our campfire and a breeze blows by, and that's Vata. And that creates an irregularity in the fire. It's a variable appetite, can lead to some gas formation, constipation. There's a Pitta imbalance. We're sitting in front of that campfire and we throw gasoline on it. Fire roars up and raises up. They get insatiably hungry. They never feel full. They can have loose bowel movements. And then the Kapha imbalance. If I take a pile of dirt and put it on the campfire, the fire becomes dull. It's a feeling of sluggishness in the digestion, that the food's just not moving. I'm full and I feel full hours after I eat. That could be a Kapha imbalance of the fire. And our ideal state is Sama Agni, which is balanced fire. Good digestion, good appetite. We're going to talk about just a couple other things here. Talk about the tissues of the body. And Dhatu is the term for tissue, and the definition is that which holds things together. There are 7 tissues. They have some subsections and off products, but these are the general categories. And in order, starting with the plasma and the lymph and going to the blood, the muscle, the fat, the bone marrow, and then the reproductive tissues, is the order in which the nourishment, the nutrients pass through the body. I bring this up because sometimes if we see a disruption at one point, then not only is that tissue affected, but everything else that comes after it is affected. So one classic example are those folks who are athletes or who exercise excessively or trying to lose a lot of fat. The amount of fat is necessary for the body and the body processes. But if their body fat percentage gets too low, for example, so halfway through the process, not only does it affect the fat, but it can affect their bone density, the quality of their bone marrow, and their reproductive tissues. So a classic example is a young female athlete who, if she's out of balance in terms of what she's doing and has very low body fat, she's putting herself at risk for brittle bones, and her bone marrow quality is affected. And she may not necessarily be worried about that, but we'll notice something like her cycles become very irregular or absent. And that's that reproductive tissue that's been disrupted. So it all interplays with each other and one feeds the next in terms of providing the nutrients for the whole body. Malas are waste products, that which spoils or decays, and those are outputs. And there are 3, the urine, the bowel movements, and the sweat. And in Ayurveda, we look at those, we think about those, and what are the qualities of the urine? Is it dark? Is it clear? Is it yellow? Is there any particular odor? And those give clues to what's happening inside the body. Similarly with the bowel movements or with the sweat, is there an unusual odor or characteristic of the sweat? That can give us some clues as to what's going on inside and how everything's working. And the end product of all of that, if we're out of balance, we've, eaten things that weren't necessarily optimal for us, it can lead to a condition called Alma, which is the presence of undigested or improperly digested food. And that Alma, in Ayurveda, it's described as a dark, sticky substance. And not only is it problematic in terms of digestion, but if it moves throughout the body, leaky gut is the modern correlate for that, it can create inflammation, and it's implicated in diseases like coronary artery disease, that plaque building up on the wall, the development of gallstones, possibly autoimmune disorders where the body doesn't recognize its own tissues and starts attacking it. A few causes of Alma include incompatible foods, so foods that are not optimal for your type, but certain food combinations are not considered optimal as well. For example, eating dairy and fruit or dairy and fish are considered incompatible combinations and can lead to the production of Alma. Eating late at night, again, if we're interfering with the body's final digestion and processing of the day by bringing in more food, that can be disruptive and lead to the production of Alma. And then packaged or processed foods can also create that as well. And Ojas, which is the natural vitality of the body, is the final product of all the digestion as it comes through all the tissues. It's the energy reserve, it's the immunity, and maintains the balance of the body. So the ultimate goal of digestion is not only to nourish all the tissues, but to produce this ojas so that the body is well nourished and cared for. Finally, I'm just going to briefly mention some qualities or attributes. These are descriptors that are used to describe the qualities of an individual or a food or a substance that they're taking. And as we saw earlier discussion, that like increases like. So if you already have too much cold or dry in your system, if you eat something that's cold and dry, that exacerbates it. So you're looking for the thing with the opposite quality. So something that's warm or moist would be more balancing. And so I just mentioned this as a way that sometimes we will classify things so that we can talk about what would be helpful in terms of balancing something that's out of balance. So just in conclusion, I wanted to include some additional resources, some books, a podcast, and the website for the National Ayurvedic Medical Association. These are all great resources for more information. If any of this piqued your interest, you want to know more in detail, that these are some great resources that are available to you.
Great. Thank you so much, Dr. Gautam, for a fantastic and engaging talk. There are many, many questions here for you. I'm going to start with I guess this is going to be a common question. From an anonymous attendee, they ask, Ayurvedic herbs are readily available. Are there any cautions about taking any herbs, self-prescribing?
Great question. So just broadly, this is not limited to Ayurvedic herbs, but a lot of supplements, they're not regulated by the Food and Drug Administration, like prescription medications. So quality and consistency can be problematic. And also, different herbs are going to have different mechanisms of action for people. And so it really is a good idea that if you are contemplating taking something, that you consult with someone who's knowledgeable on the effects of the herbs and also can talk to you about how they might affect you. And also, with that, can talk to you about brands that might be more reasonable or have a better track record in terms of safety and quality. And that way you can be at least somewhat reassured you're getting what it says and not things that are not helpful. In general, for example, I'm going to use the example of turmeric because this comes up often in my clinical practice. I know turmeric comes in capsules, and you can get these everywhere. But we want to think about the context of that. Turmeric was not meant to be taken in a capsule. Turmeric was meant to be taken in food. And so initially, turmeric was going to be the cure-all, and then but it missed out on the fact that a little bit of black pepper needs to be with the turmeric in order to make it more bioavailable. So that's really important. So in including it in your cooking, you're more likely to have gotten that. Now everyone puts black pepper extract in their turmeric supplements, but you're still sort of missing out on the context in which these things were meant to be ingested. So, if someone wants to use turmeric, for example, and there are some caveats even with that, I tend to say use it in your cooking rather than taking it in a tablet form, that you'll get more bang for your buck overall.
Great. Perfect. Related question, maybe possibly from the same attendee. Are there any issues with lead contamination, or let's extrapolate that out for any type of contamination, especially heavy metal contamination of certain Ayurvedic herbs? Is that a known issue?
So we have seen that in turmeric, some lead contamination, also heavy metal contamination of other herbs. So just with caution, using those. And again, in small amount, these things are meant to be taken in small amounts. When we put them in supplements and capsules like that, then they're ingested in much larger amounts in which they were meant to be taken. But yes, you want to make sure that, if you are going to undertake taking herbs or supplements, that you do consider consulting with someone who's knowledgeable in that area and can look at your health history. I mentioned even turmeric has its caveats. An excess of turmeric can predispose you to bleeding. And so that would be important to know just generally, but especially if someone takes aspirin or a blood thinner, that you would not want to then be taking large amounts of turmeric in addition, because it can also thin the blood. And that's just one example of how, just because it's natural doesn't mean it doesn't have any potential side effects.
Great. Perfect. Question from Rama Tabruwal. Sorry if I messed up your name. Is acne a manifestation of imbalanced pitta?
Yes. So the inflammatory red pus of acne, then yes, that can be a manifestation of a pitta imbalance. So looking back at the diet, trying to maybe stay away from spicy or oily or sour foods can possibly be helpful for that. And again, trying to focus on your fresh fruits and vegetables, those things that we know are helpful for us overall, can also be helpful for the acne.
Perfect. from Nitish Amin. Not sure I understand not sure I understand time of day means to doshas. He wants a little bit more explanation.
Sure. So that there are certain energies or doshas that tend to dominate certain times of day, and that governs our actions during that time of day. So in the kapha time of day, in the morning, that's a time to really get up and get moving. That's why you want to exercise in the morning to sort of overcome that kapha. In the evening, that kapha time is a time, we've completed hopefully most of the work of the day. We can start winding down and getting ready for bedtime. The pitta time of day, the fire is the highest at noontime. So that's when pitta is strongest. And so that's when we want to eat our main meal. At nighttime, the sun is not there, but that's the main time for us to finish our digestion of the day. So that's the interplay of the doshas and time of day in terms of how that governs our activities. For some people, the Vata energy is a creative time. So maybe that time in the afternoon is a good time to have those brainstorming sessions, where you're thinking about those great ideas because that Vata energy is a bit more predominant. And so you can think about it in that way too, that maybe that governs to the extent that you control your schedule, how you manage what happens during different times of day.
Great, perfect. From Andy P. After attending your last ETAM meeting, although they're both still on the fringes, TCM is somewhat more recognized through schools and licensure. Ayurveda seems less so and more challenging to find clinicians who are credentialed. Would you agree with this generalization?
So I think Ayurveda is newer overall to America than TCM. I think there's been more experience with it, especially acupuncture is more widely available, accepted, studied. And the National Ayurvedic Medical Association, the link I included, they are a national group. They are working on credentialing and standardizing educational parameters for different schools of Ayurveda. They also have a list of Ayurvedic practitioners, so that if you were interested in consulting with someone, they have a resource of people who are have gone through that process and have that accreditation, and the schools that are accredited. So you can look up and see, oh, someone went to XYZ Ayurveda school. Are they accredited by anyone? So that you have some understanding that they do have some, basic fundamental educational background. But that's a great question. I think, the interest in Ayurveda has increased just in the several years I've been interested and involved, and I expect it to continue. And with that, more standardization and hopefully wider acceptance.
Great. A related question. An attendee wanted to know whether you see patients for consultations. I know you practice primary care, and if you see patients in consultation, do they need a referral?
So I am a family physician. I do see patients in clinic. I'm currently seeing patients on a limited basis in terms of one-on-one Ayurvedic consultations just because of availability. But I am happy if someone's interested to try and accommodate them or refer them to Ayurvedic practitioners in the area.
Great. Question from Sunanda Agrawal. What's your take on ghee?
Ghee which is clarified butter, is sort of a central component of cooking and thought to be good for all the doshas. So I think in moderation, it's okay. Someone who's Vata predominant probably could stand to consume a little more than someone who's Kapha predominant. But yeah, I mean, it's a fundamental food in Ayurveda. For those who, don't want to eat dairy or vegan, that's fine. Again, let's be practical and meet people where we are. So it's not something that I insist everybody eats and, has to consume.
Great. We're running out of time, so I'm going to close it I'm going to combine two questions together from Divya Macharya and from Andy P. They're both asking about comparisons of TCM and Ayurveda. Do they have something in common? What are the differences? And specifically, how do the pulse diagnoses compare?
Oh, wow, great questions. So Ayurveda and TCM, yes, are both ancient healing traditions. They do have a lot in common. They're early texts of Buddhist monks from China traveling to India and their commentaries on Ayurveda. And so there is some commonality in terms of thinking of the universe in terms of certain elements. TCM, they have different ones than Ayurveda, but that elements, the balance, back and forth. So there are a lot of commonalities there. So I think that's great. And I'm sorry, what was the second part of the question
Just the
about?
pulse,
The
how
pulse
do the pulse
diagnosis.
diagnoses
Yeah.
compare?
So yeah, I'm not as familiar with TCM pulse diagnosis. Ayurvedic pulse diagnosis is its own like whole field. But I do think there's some commonalities in terms of being able to detect different conditions, different disease states, the overall balance of the system just by the pulse. And it's remarkable having experienced it. I'm not at all, you know, an expert in terms of pulse diagnosis, but yeah, but that's seems to be a powerful component in terms of diagnosis in both traditions.
Perfect. Well, thank you so much. I think we're running out of time. Really fantastic talk today. Please share. We have an evaluation, a way that the audience can provide evaluations. This is very helpful for Dr. Gautam as well as for our talks. So if we could share the last slide with the barcode, we'd really appreciate your help providing an evaluation for Dr. Gautam and for these talks. Can we share the screen, the last slide, Ryan or Dr. Gautam?
I have the slide up. Give me a moment and see.
And there were several questions about the slides and the video. I'm not sure if you'll be willing to share the slides, but we're happy to post them. But the video will be available if you go to care.stanford.edu in a few days, as well as through the Stanford Health Library. Also on if you can also search on YouTube as well for the talk. But do we have the share slide ready? And we will be taking a hiatus for the summer. There won't be any talks for the summer, but we'll resume in the fall. So please check back at our website, care.stanford.edu, for details on the next talk when that comes available. I think you may need to do a slideshow. Perfect. So if you could possibly, if that works, to scan the barcode and give a review, that would be fantastic, an evaluation. And we will also email out this barcode as well to all the attendees, as long as with the video link information. So with that, thank you for your attention this evening. Really appreciate Dr. Gautam and all the attendees, as well as the Stanford Health Library and the Stanford Video Center for supporting this talk. Really have a great weekend. Have a great summer.
Bye-bye.